Well, breast cancer and endometriosis patients have recently been told a drug they've been relying on is being pulled from the PBS and from Australians' shelves. AstraZeneca recently wrote to clinicians saying the 3.6 milligram dose of Zoladex would not be available here from the start of November. With more, here's reporter Mary Lloyd, and she joins us now from Sydney. A very good morning to you, Mary. Just exactly what does this drug do? Why is it so important?
Yes, so Kath, Zoladex 3.6 milligram, and we'll get into the other dose in a bit. It's used as an ovarian suppressant, and that's important in some breast cancer patients. Some breast cancers are fueled by estrogen in the body, and the ovaries produce estrogen. So when clinicians are looking to either reduce the risk of recurrence of breast cancer, or in metastatic breast cancer patients, they're looking to slow the tumour growth, they will prescribe Zoladex 3.6 milligrams. So that shuts down the ovaries. It kind of puts them into a bit of a hibernation, and it stops them from producing that estrogen. It's also used in patients who have endometriosis because it tempers the growth of that lining of the uterus, and so it can be useful, beneficial to endometriosis patients as well. But the thing about it is that there is currently not an alternative on the PBS, so it's currently publicly funded. And so if it's not available from the 1st of November, those patients are going to have to find something else. There are some other variants on the global market, but they're not approved here in Australia. There is another formulation. It's the 10.8 milligram dose, so it's a higher dose. That's given and it's longer acting. Currently in Australia, that's only approved for use in prostate cancer patients. So there's a bit of work to do to make sure that is available on the PBS to breast cancer and endometriosis patients should they need it. Once this dosage
comes
is gone.
in. Yeah. So tell me, Mary, what is your understanding about why the manufacturers made this decision?
Well, we don't have much. So AstraZeneca wrote to clinicians and to the government earlier, a couple of weeks ago, and they told them that it was for commercial reasons. The statement that they've put out is that it is a global AstraZeneca decision to reduce the dose options available in some countries. We've asked the health department about this, and they've also said that it's commercial decisions. We've gone to AstraZeneca about it, and they haven't expanded on the explanation that they've given. And this is an important point. They also weren't able to tell us which other countries this dosage has been pulled from.
So, Mary, how are patients who are currently on Zoladex, ones that might be looking at starting Zoladex, how are they feeling?
Look, I think that there is a lot of confusion out there, confusion and anger that this drug that they rely on. So for some women, it will be life-lengthening. If breast cancer patients with metastatic breast cancer, it's possibly slowing the growth of those tumours, so it could be life-lengthening for them. And for early breast cancer patients, Zoladex is used to reduce the risk of recurrence. So for them, it could be life-saving. So there's a lot of anger that this has happened. There is some reassurance because AstraZeneca has said that they are going to be launching a patient access program from the 1st of November. So if patients cannot get alternative medications, then they will be able to get it for free from AstraZeneca. So there's some reassurance out there as a result of that. But, going through breast cancer is very difficult. So a lot of these women who are on this drug, they've had massive surgery, possibly gone through chemo. Now they've been forced into medical menopause, effectively. So it's very challenging for them to then also hear that possibly this drug isn't going to be available for them.
Mary Lloyd, thank you very much for the update.